My name is Ravi Vij. I'm a professor of medicine at Washington University in St. Louis. I'm here at the American Society of Hematology meeting in San Diego. I am presenting here the abstract in an oral session that looks at Ixazomib with lenalidomide and dexamethasone as consolidation therapy post-transplant, followed by randomization to maintenance with either Ixazomib or lenalidomide. This trial is a 240 patient trial that has accrued for most part. The data presented here at the meeting today was looking at the patients who got consolidation therapy with Ixazomib, lenalidomide and dexamethasone. The regimen was well tolerated, with very few patients requiring dose reductions and discontinuation of therapy. What we found was that the minimal residual disease negativity rates by very stringent sequencing from adaptive technologies that picks up one cell abnormal in a million was able to reduce the MRD negativity rate further after consolidation therapy. At the end of the transplant, when we looked 3 months after transplant, about roughly 22% of patients, 20% of patients were roughly MRD negative, and when we looked after consolidation, we had increased that to about 30% using stringent criteria. So I think that this data is something that tells us that we can deliver Ixazomib with lenalidomide and dexamethasone safely in this population, and that it is effective in reducing the disease burden further after transplant. How this translates into long-term outcomes remains to be established, and also we have started the process of randomizing patients to Ixazomib versus lenalidomide, and roughly about 70-odd patients now are in each arm. The follow-up is too short, just over a year post-randomization, and so no conclusive presentation at this meeting was able to be made regarding the benefits of lenalidomide versus Ixazomib for maintenance. However, we hope to have data on that aspect of the trial somewhere next year or beyond. Thank you.